Right. So, good morning, everyone. Good morning. Let's have more energy in the room. Good morning. Yep. All right. So, thank you for the intro. And yes, as he rightly pointed out, I think what we discussed right now in the last 1.5 hours to 2 hours of time is how do we build a better hospitals? How do we build a better healthcare? As the sir spoke about what kind of healthy materials we can use within a hospital environment. But I think what we also predominantly feel is security also plays a very critical role there, especially if you look at from a hospital environment point of view, or if you look at from a technology adoptions, what hospitals have gone through, or the typical healthcare have gone through. I think the security space is very, very large. So we'll talk. I have 10 minutes. I think I can extend maybe a couple of minutes, but I'll try to be within the time itself. All right. So we spoke about this. I think the panel discussions was more about that, talking about patient experience. Now, what is more important here is similar like any other enterprises, what you have seen across the healthcare or pharma or life sciences as a vertical or as a team has not shied away from anywhere from a technology adoption point of view, which means there has been always forward thinking from a technology adoptions what a healthcare or a pharma or life sciences have gone through. The classic examples, we can cite many examples, but I just want to share maybe 2 or 3 examples here. So one, we speak about, let's say people like me, how can I reach the doctors as soon as possible? Let's say, working in a city like this, it's much more easier to connect back with doctors. But especially if you look at more from rural areas, how can they talk to doctors pretty much easily? Or how can we get the experience what they want, especially in a rural sector like that? So if you take an example, right, in our case, we have much more ways and means to connect with the medical systems what we have here in the city. But if you take an example of, let's say, the government recently launched e-Sanjeevani, right? That's one of the app which government recently launched so that the rural team or who is working in the rural areas can easily connect back with the doctors, or they can get with the healthcare systems whatever they wanted. So that's one example of a transformation what the healthcare industry have gone through. On the other side, if you look at, there has been a lot of cloud adoptions today. I'm sure it will be much more larger on the private healthcare side of things or private hospital side of things, but there's a lot of adoptions with respect to the cloud side, which means today, if you take an average, a lot of hospitals use, a lot of healthcare industries use close to around, that's the statistics talks about, close to around 15 to 20 types of cloud-based applications. And these cloud-based applications could be in different form factors. For example, this could be a supply chain softwares, this could be a health record softwares, this could be a finance softwares, or this could be an imagery or a clinical systems-based softwares. So a lot of adoptions in the cloud space as well is what we have seen over the period of time. And the third part, what you see is in terms of smart devices. Smart devices are there everywhere. It's there in our houses as well. I think we spoke about automation in the morning. So our houses are fully automated now. We can do a full-fledged automation for our home. And I'm sure the hospital industries are using a lot of automation, especially with respect to the medical IoT part of things. So robotics, robotic-based surgeries, etc., which means a lot of connected device within a hospital environment as well. So what we are seeing here? The trend is very large. The trend is very fast. A lot of adoptions from a technology point of view, and the flip side of this is this. Again, I think a lot of news have been there in the articles in the open forums. For example, let's see if you take about a major issue what hospitals are facing, or a healthcare or a pharma or a life sciences industries are facing, is in terms of the threat landscape. So let's say if my internal systems are affected in one way or the other, I think we already read about the news of one of the government-owned hospitals which got under attack. So I don't want to name them, all of us know. But yeah, that's a classic example of there is no difference what a healthcare or a pharma or a life science can go through. The threat vectors are there for sure. And that's where something which we need to be very on top of that. So that's the first part what I want to talk about. The second and third, again, I spoke about this. Most of the medical systems or most of the IoT systems or IOMT, what we call it as Internet of Medical Devices or medical things, what we speak about are designed for a specific purpose. They can solve a specific purpose, but they're not designed to be secure by default. Right? So security is there, definitely is there, but it's not designed to be secure as strong as possible what is needed. So that's again one more problem areas what everybody is going through at this point of time. And the third one we spoke about earlier is in terms of the cloud-based applications and the data which actually gets stored in your cloud-based applications. Assuming that I have a patient records on my cloud, I have my doctor information on my cloud, I have my database inside my cloud, and what if, let's say, somebody takes the data out? That's a classic case of a data exploitation, what happens within an entity like us. So that's a classic issues, or from a cyber security landscape point of view, the threat landscape point of view, what everybody faces today. I'll skip this guy in the interest of time. Again, we spoke about this from a tech adoption, and you will see a lot of adoptions, especially the 5G is here now. And I'm sure a lot of hospitals, a lot of healthcare or pharma industries are moving towards 5G or adopting 5G much more widely within their internal infrastructures. We are speaking about AI. We are talking about AI like every day. You speak about AI everywhere, right? Why not hospital industries can use AI much more in an enhanced way? I can put it in that way. Are you using it? I'm sure you will be using it, but I'm sure you will be enhancing the usage of AIs in the coming period of time. So having said this, what is more critical is one, the way how we transform our cybersecurity focus area today, or let's say how do we change our cyber hygiene what we have currently. Yes, I'm not saying that the healthcare industry as such, I'm not generalizing that is not secure, but there are different scale of security what everybody follows today. And that's a practice which slowly we'll have to change or we'll have to make it tight, because as and when we grow forward, I think that area is something which we'll have to be very wary about. And this is very important because if you look at from a use cases point of view, so we spoke about how can we get care from anywhere. I can sit at home, connect back to a doctor. Anybody sitting in a rural case can talk to a doctors. Let's say as a large scale organizations, you may be doing M&As. Let's say we spoke about some hospitals being part of a larger conglomerate, right? Or maybe a private hospital, so maybe part of Manipals. I think we spoke about that. Now, a lot of these merger and acquisition scenarios comes in, connectivity from everywhere comes in. I may be a physician, maybe doing my research in one of the universities, but I need to still connect back to my hospitals for some data points. So there are many use cases what you can think of from a connectivity perspective, from a data security point of view, from the access point of view. There are many use cases what we can speak about, especially from a healthcare industry perspective. And again, we spoke about the IoT devices, especially within hospital environments. How can we ensure that these kind of devices are much more secure in nature? They have been used securely, they have been consumed securely. There is no kind of a problem statement what we can see, especially in those factors. So this is a focus area what we are currently focusing on from Palo Alto Networks. And I think it's very easy for organizations like yourself, maybe if I take each one of you, so that I can fix this problem with, let's say I can buy a particular product, fix the problem there. Let's say I want to have a care from anywhere, I can buy the tools for that. I want to secure my IoT systems, I can buy a tool for that. I want to secure my cloud, I can buy a tool for that. So which means within your enterprise, who is managing your IT team, who is managing your enterprises, have a challenging job, so that because I have too many things to manage from a security landscape perspective. And unfortunately, all of these things doesn't talk to each other as well. And that's the problem statement what we have. So what we have been focusing on from our perspective is threefold. So I'll just keep it short so that I'll keep it very high level. So first part, what we've been focusing is on network security, which means for you as an organization, if you want to secure your physical data centers, if you want to secure your connectivities, or if you want to secure your remote connectivities, we have the platforms for that currently in place so that we can secure that end-to-end traffics for you. From a cloud world, we spoke about that, but if you have cloud-based infrastructures, if you have your data points on the cloud side, how can we ensure that that infrastructure is fully secured in nature, so that there is no data theft which is happening at the cloud scale, or the kind of applications what you're using, there is no data theft which is happening, because patient records are very critical, right? For example, I'm sure all of you agree. And how do we ensure that that part of security is taken care of? And I'm not sure whether many of you run an InfoSec team or a SOC team internally within hospitals or a pharma or life sciences industry. But however, if you have a larger team which is managing your InfoSec or information security, there should be the right amount of visibility what should be provided for them, like what is happening within my digital footprint, right? So I'm connecting from home, is my machine secure? I'm connecting back to my hospital data centers, is my server farm insecure in nature? I'm talking as an administrator, I'm talking to my cloud applications, is my cloud secure in nature? Or from a medical devices point of view, or let's say smart devices, are they secure in nature? So your InfoSec team should have good amount of visibility, solid visibility in terms of what happens within my enterprise. So which means on the other side, we are building a great hospitals, great healthcare. At the same time, we should also be ensured that the security should be much more stronger there as well. And that's where we have been focusing. Again, I'll not get through the detailing of each and everything. So whatever solutions, what we need, or whatever challenges or business requirements, what you would need from an organization point of view, I think that it's already available. Again, as I said, connectivities or securities or an InfoSec, or if you want to have a service, let's say if I want to know, for example, if I put forward a question like this, within my hospital, do we know that I am compromised today? If I ask a question to a CISO, right, how fast you can answer that? So if I'm a hospital myself, I'm a CISO, somebody asks me, are you sure that you're not compromised? How do we answer that? So that needs a good number of visibility. And that's where, again, as I said, a lot of areas what we have been focusing on. I'll not go through details one by one, but I think we can help to ensure that your industry or your connectivities or your users are always secure at any point of time. And today, if you look at from our point of view, we have been connecting across multiple hospitals. I have not put the India data here, but however, if you look at larger organizations from a healthcare point of view, again, as I said, pharma or life sciences, there are many number of organizations what we are securing end to end. Again, depending on the business requirements, what they have, what is the need to secure, what kind of information needs to be secured, we are there to help customers to prevent that or secure that infrastructures for them. I think that's what I had to cover. I know I've kept it very short. I know we have only 10 minutes. I've kept it very short. But however, end of the day, cyber hygiene or cyber safety is end of the day patient safety. We spoke about patient wellness, patient experiences, but end of the day, you should have a cyber hygiene or a cyber safety as well. Thank you.
Thank you very much, Mr. Sandeep. If you'd like to connect with Mr. Sandeep or any of his colleagues from Palo Alto Networks, they will be available during the networking break, which is happening right now. Please let us go for the networking break and come back here in approximately 15 minutes, give or take. On the other side of this break, we have a number of interesting discussions, first of which is the new and emerging technologies of smart hospitals. All of this and more on the other side of this break. See you soon. Okay, ladies and gentlemen, we are going to start the second panel discussion. And in fact, this is the first item on the agenda for the second part of the HealthCare 360-degree Summit. The topic of this panel discussion is smart hospitals. What are the new and emerging technologies? And some of the very important questions that will be asked and answered during this discussion are, first of all, what is a smart hospital? Secondly, what does it take to build a smart hospital? And thirdly, it's all good to talk about smart hospitals, but are there any challenges involved? And if there are, how do we overcome those challenges? All right, so promises to be a very exciting discussion, and I certainly look forward to hearing what our esteemed panelists have to say. So please help me welcome our panelists onto the stage. We'll start with Mr. Shivankar, who's the Senior Director of IT at Manipal Health Enterprises Private Limited. Please help me, Mr. Shivankar. We also have Ms. Deepika Thakur, who's the Head of India Business Development at Cleveland Clinic. And also we have Mr. Bhupendra Solanki, who's the Chief Information Officer of Sakra World Hospital. And the moderator for this discussion to ask all of those pointed questions and ensure that we get the answers that we're all looking for is Mr. Bharat Gera, who's the founder of the human-centric healthcare ecosystem. So to all of our panelists, the stage is yours for the next 40 minutes or so. We look forward to hearing all of your insightful comments and analysis. Over to you.
Thank you so much. And it's a real privilege to be here with these esteemed panel members. I think the first question is already answered. How do you build a smart hospital? You have smart people like I have with me on the panel right now. Without much ado and not holding back so that we finish early in time for lunch, I'm just going to start with a question which we've seen answers in the previous discussion already. We've heard about what is a smart hospital, but I'll start with this, basic point here. Like when we go to an airport, like the Bangalore airport, we know it's a smart airport, right? Right from the time you walk into the airport and walk into the plane and how the staff get coordinated and how the slots get coordinated and how you get checked out. It's all a very, very smart experience from the Dishiyatra to everything. Even when you go to a restaurant these days, you have a QR code placed on the table and you have the order being processed through digital methods at the back end. Now, when we look at the same thing in hospitals, what does it translate to? What makes a hospital really smart? So I want to ask the panel this question. I'm going to start with Shivankar on the extreme. And Shivankar, you're from Manipal, one of the best hospitals in the country, and you've done a lot of work in this area. So what makes a smart hospital?
Thank you. And good afternoon to all. Uh, my name is Shubhankar. I am heading digital strategy and digital innovations in Manipal, and uh, and as well as IT operations also. So, smart hospitals. Hospital definition should be surrounded by your consumer need basically. Who are the consumers? Our patients or customer who are looking for some sort of uh, help, and they may be community or they may be your friends folks. So all peoples who uh, are in need of your some health related help. It can be preventive help, it can be your post care help, it can be onboarded help also when they are admitted into the hospitals. It can be there. So the requirement, their expectations from the organizations, from the whole ecosystems, if we try to feel them good, like an ease feeling, if I give all those facility to those consumer, then it becomes a smart hospital eco-care system. Now, to make these smart hospital ecosystems, we generally take help from technology and automations of the processes. Automation of the processes, it can be your inter ecosystems also into the hospitals and outside the hospitals also. So we have to define in that way that what are the processes where patients generally feels hindrance when they come into the systems. It can be appointment systems, it can be your reception, it can be your PCC desk also, it can be your queuing systems, it can be when the patient's attendance is sitting in anxiety, how you are treating them also. So you have to identify what are the processes where patient feels agitations maybe. You have to identify those things, and you have to put automations, you have to put technology, you have to put your humanity over there.
Fantastic. So
Yeah.
all of us in the technology world believe the same thing the CEOs in the previous panel were saying, that it's all about patient experience, right? So
Yes.
that's a great point. Deepika, you want to bring in some your experiences in what you consider as a smart hospital, and Deepika, being from Cleveland, will bring in a global outlook to this.
Thank you, Bharat. Good afternoon, everyone. My name is Deepika, and I lead the business development efforts for Cleveland Clinic in India. I just wanted to give you all a caveat that most of my experience has been from the US, so pardon my language lingo, if it's off. But if you'll ask me, what is my definition for a smart hospital, I think several components come to mind. But I want to touch upon a few which I feel are important. The first one being, does high tech actually translate to better patient outcomes, to safer care, and to better patient experience? And is the smart hospital able to deliver all of this at a low cost? So I would say, this is the value-based equation that, we offer at Cleveland Clinic. We always focus on higher outcomes, safer care at low cost. The second aspect, I feel, is the smart hospital giving or providing seamless access to its patients? So a few years ago, one of the challenges that we experienced as a health system was longer appointment times. The waiting times were sometimes exceeding 30 days or so. And our administration had challenged us, to fix this problem. And we rolled out a campaign called Power of Today, which guaranteed same-day appointments. So the way we did that was by centralizing our outpatient scheduling system all under one roof, where the schedulers actually had access to all the providers' calendars, and we were able to track or map the patients based on their region to the closest physician. So that was one example of how we started, improving access, and now it has actually expanded to care everywhere, where we're able to offer urgent care clinics, express clinics, virtual consultations, and we just talked about telemedicine, which also expands to patients in India. So I think access is important. The other aspect is integration. And what I mean by integration, at least how we've integrated the systems within Cleveland Clinic, is one example is radiology. So if you're a patient from, say a hospital X of Cleveland Clinic system, and you've gotten your CT or PET scan, and you go to another hospital or another provider within the same system, you don't have to carry your CDs. All the radiology imaging is centralized. We use Dynamics as a vendor, and it's all located in an enterprise library. So anywhere across the US within our system, those images are all centralized. The other examples I can think of is data integration and data analytics. So across the system, we have centralized all the quality data. We use web intelligence tools. And the way we've been able to impact patient care is by reduction of measures like infection. So when the providers actually look at their own data, on a scorecard which is displayed, in our meetings, there is obviously they are able to measure themselves. And a lot of physicians intentionally or unintentionally don't have access to their data. But when this process started, their infection rates came down. Not only did it impact the patient quality, but also the costs. The cost came down. Last but not the least, I would want to say a smart hospital is one where the leadership knows where to employ or deploy technology and where humanization is needed. So while a lot of other healthcare systems in the US use wayfinders or navigators for patients when they come in to help them around the hospital, we actually deployed physical in-person greeters, what we call red vest codes. And they're planted in very strategic locations across the hospital where patients usually get lost. And this is one area where we felt technology is not a solution. So I think that's always important to understand where technology can be used and where the human elements become important.
Fantastic. So you're saying the entire patient experience and the even the hospital infection, so even the outcomes could be part of the smart hospital mandate. Fantastic to hear that and the global outlook on that. Thank you so much. This is coming to one of the most well-known hospitals in Bangalore, Sakra Hospitals, where Bhupendra has made a lot of changes in the technology side. So I'd love to hear from you, Bhupendra, on what you see as the smart hospital.
Yeah, good afternoon, everyone. Being a smart hospital, first thought comes like it is leveraged with the technology. Yes, this is the one of the part, but the clinical care also important. If like clinician getting the information on time and prompt response coming from the clinician to the patient, and then patient treatment will be better. So that also one smart hospital journey. If you talk about like outpatient, so outpatient, we thought how we can resolve this issue. Earlier they take appointment over phone and all, but now the world is going to based on the technology and automation. So we thought over night and then come back with the solution. Like if patient is doing a prepaid appointment over WhatsApp or website or mobile app, then they should not stand in the queue at the hospital billing desk. Then what we plan, once they book the prepaid appointment and coming to the hospital, then they have to do the check-in either through their mobile app or our kiosk. So straightforward, that data will go to our HIS, and then HIS generate the invoice automated way, and his name getting reflect in the QMS system of the doctor's OPD room, outside the OPD room. Then he can sit and wait for his turn. So that complete automation we brought into our system, that helps, that increase the patient experience. Once doctor calling from the inside, then in progress is coming and patient can go and consult with the doctor, and during the consultation doctor feeding the EMR, and that EMR once he finish, it is going to their email ID and getting pushed to mobile app and WhatsApp. So this one of the example which we brought in the OPD patient. Similarly, we are bringing for IPD patient. IPD patient mostly spend the time in the IPD room. So where a doctor going along with 3-4 doctors, nurse going, and sometimes this GDA, clinical nutrition, many people goes inside to take the information. So what we thought, to minimize that footfall and complete automation, we are bringing a smart IPD room where clinical care, nursing care, and clinical nutrition care, we are enabling in one touch screen monitor where they can do with face detection then and there, no need to note down, and there is no possibility to miss the any input like diet need to prescribe or medicine need to prescribe. So it will hit to the respective department, and respective department will act on that immediately. So earlier, if you talk about a 5 year or 10 year ago, notification system very less in the HIS system, the hospitals. Now we are working on that. If notification pertaining to anything like cancel appointment, if patient is getting, then patient can plan his next visit. Same way, if doctor getting notification like this laboratory parameter, or this diabetic patient getting a 205 or 209 this diabetes, then they can take the immediate action. So that prompt response also we are bringing into the smart IPD room. Also, three things we are giving in patient hand without any authentication, like they can see the informative videos related to clinical care, related to hospital orientation, related to ward orientation, and any service request like AC not working, or food is required, or TV is not working, or particular channel is required, that way. And third thing, nurse call. So nurse call we kept from the service request separate, because nurse call is a critical care parameter. We should not club with the service request. Service request may be delay for 5 minutes, 10 minutes, but nurse call can't be. So this way we are planning. POC is done. Now we are in implementation mode for the smart IPD room. OPD already we started 1 year ago. It's going well. And then patient experience, we are getting the feedback day by day. It's getting increasing, and satisfaction is more. So Sakra working on the self-help concept, like whatever things we can provide the patient without compromising the patient care. So we are exploring those things and giving the patient hand. So we are thinking the smart hospital in such a way where with the help of technology, we can help both the parties, means patient as well as clinicians. This is our thought.
Fantastic. When many years back Sakra had started, there was this talk about Toyota bringing its methodology to the hospital world. I think we've seen a lot of, at least when I've traveled in Southeast Asia, what I've seen is Southeast Asia has some really advanced hospitals. One of them is in Korea, the Samsung Hospital, and that's kind of an ideal for a smart hospital that I've seen. 10,000 plus patients a day. So you can imagine like an All India Institute of Medical Sciences, but absolutely no friction in getting people in and out. They just move the people through the system really, really smoothly, like an airport does. So how did they build this kind of smart, infrastructure? They've done this in Singapore also in one of the hospitals. One of the things that's very well used, if I understand, is the command, control, and communication system. People talk about, why can't hospitals be as smart as airports? But there's one fact I'd like you to keep in mind. To run an airport, you need about 35 odd teams. To run a hospital, you need 65 plus teams. So you're going to coordinate the activities of far large number of teams in a hospital than you're going to do in any other facility in the world. The other dimension of smart hospitals that we were just discussing over coffee was from a technologist, we are all technologists and, technology-enabled services people here. And from our point of view, one of the most ideal thing is what Sai was telling he was asking Dr. Nandkumar Jairam that, do we even need hospitals? And can the smart hospital be a virtual hospital which is in the metaverse? And I've seen a Korean hospital actually put itself in the metaverse and let people, the patients, visit them on the metaverse. I think my own view and what I hear from all the panelists here is that it's not going to be a metaverse. It's going to be 100% virtual. Like Dr. Jairam said, there's always going to be physical hospitals, but we can make them a hybrid reality where it's seamless, as we just heard from Deepika and from Shivankar and from Bhupendra. So all of us, see this hybrid reality of a smooth journey of the patient from virtual to the physical world and, continued care and so on. Now, it takes a lot to build this kind of a smart hospital. All of us in this panel have been through these experiences. I want you to share your actual experiences and not theory of what it took. What was the journey like to build a smart hospital, and what is the journey going forward?
You are correct. When it's come to the reality, uh, that's different basically. What we talk here on dais is different, and on reality is very hard to implement. And being a technologist, because we are the support services on healthcare domain, although it's a most important support services in healthcare domain, now we are getting all kind of importance that we are the backbone of the hospitals nowadays. So, see, there is, you can start your journey by introducing small technology-based applications, yeah, automations also. Very small step we can start it. And you have to study, as I told you, you have to study your consumers first. Nowadays, I can trust that out of all these people's, 90% people, when they open first their mobile, they just go to the WhatsApp first, rather than looking other SMS services, yeah, other applications. Their first look is on WhatsApp, any message came or not. So fast communications, what we understand that between patients and the hospital should be via WhatsApp. This is the one of the most important channel to speak, yeah, to be touched with the patients, right? So if I start the journey from appointment, taking appointment here, doing the registrations kind of activity, which can be off-site also, like you are sitting at home, you can have an appointment, you can do your registrations. But what is the most easiest way to do that? So we just built a kind of AI-based bot systems on WhatsApp. If you say hi, then you can go through all the flow. Like bank has done much before. Now healthcare is doing. So this is one of the channel you can communicate to the patients also. Now, how suppose a patient is doing any kind of inquiry on a particular surgery, a procedure, because they can validate different organizations. Maybe some patients is asking Sakara, some patients is asking Manipal, Apollo, so and so. So now you have to give more to the patients that patient should land on your hospital. That is some sort of business sense is there. But still you have to engage that patients, how you are engaging that patients, right? So if we give something extra things, so that thought came out, and then we built a knowledge-based bot systems. Like if you are asking something, you have a query on the particular surgery procedures, you should get the knowledge from the organizations also, right? You can talk to the doctor also before you can take the decisions. So how you are engaging your doctor before taking an appointment also. So that is the concept is coming. This is almost also have the business sense, but it's a technology-based solutions. Next, when patient is coming on your organizations, like how you are receiving that patients. Like you mentioned that there is a tracker, how patients, where is patients now? Maybe you send some ambulance, where the ambulance is there. So all kind of tracker and continuous, you are engaging with that patients, right? So on that view also, if I take the business part from that communications, we are engaging with Google. I'm telling you, we are engaging in Google. When you are seeing any Google map, suppose you are going from one destination to other, you just see the route map, right? We are putting something that nearest ambulance, Manipal ambulance, where it will be. So on your Google map, it will automatically come Manipal ambulance how far it is just on your journey. So Manipal will be engaging with on your Google map also. So this kind of engagement we are doing, right?
Smart, very smart.
And even like voice-based EMR systems. We tried many times last 10, 15 years. I am in the healthcare industry last 18 years. It's a very difficult to convince doctor to give their input into the computer systems. Very difficult, right? So now we are on discussion with Microsoft, and I think you people are well aware about the MS Teams, Microsoft Teams also, where the collaborations you can, if you can talk to that on that tool to someone, suppose your conversation is going on, whole conversation will be converted into the prescriptions, yeah, word format. So
Fantastic.
doctor is talking to the patients. If they are talking to the patients on that platform, so that platform will give you the whole prescriptions, right? And there will be a little bit addition deletions, and then it can be generated the prescriptions. Like Google is offering Google Lens also, and on your scan document they are giving you the structured data, but it's still on your research phase. But Microsoft is coming with MS Teams these features. So it will be a game changer in on your voice-based EMR systems, right?
Great to see the number of innovations that are in the pipeline. And Deepika, we would like to hear from your perspective. How do you go about, both the tactical and the strategic aspects of making a smart hospital?
Sure. So, from our organization standpoint, to achieve becoming a smart hospital, what has always driven us is what, in my words, is SMART goals. We're a very data-driven organization, and we have an organizational level scorecard with key performance indicators at various levels that drives all the decision making. And again, the framework for the scorecard is, we have measures for quality, we have measures for outcomes, we have measures for safety, operational throughput, turnaround times, and then the regulatory indicators. So when we looked at our EMR system, and I think we are fairly mature system, over 14, 15 years back is I think when we rolled out our EMR, which is Epic. So when we started creating the electronic medical record system, the first aspect that we considered was what are the strategic data points that we need to collect. Because back then it was mostly text-based, provider, descriptive notes. There was lack of objective data. And the state government, the insurance companies were beginning to ask us very specific and targeted questions, which the clinical documentation did not cover. So then, so we created these committees, and I'll say the three fundamental pillars that actually helped us drive ourselves to the smart hospital system is the alignment of people, process, and technology. So various stakeholders come together when it comes to the technology decisions. It's not just the technical team, obviously. So some of the stakeholders from a people standpoint is, we have a CIO, obviously, the hardware and, the technical decisions and the team reports up through the CIO. Then we have a CMIO, which is the Chief Medical Information Officer. These are all the clinicians and physicians who have an input in, what kind of technology needs to be selected and, what are the criteria that go into from a clinical standpoint. And then, of course, we have various other department heads, subject matter experts. So if it is an oncology system, then you have, the oncologists. Or if it's a cardiac system, we have representation from the cardiac folks. So you have the department heads, and then, of course, you have representation from our patient experience office. Then we have a caregiver office. And then we have our accreditation office. So all these stakeholders come together and meet periodically to make decisions. It's never, a siloed process.
So you're saying the key is your governance and the organization of
Right.
the goals.
Right.
Fantastic. Bhupendra, how do you go about, putting all the technologies in place to make a smart hospital?
Yeah, we have a one three-member committee which targeting the department-wise and analyzing their processes, and then how it's going to convert with the help of technology for the ease of patient as well as the internal staff. So that committee works always, and then once they finalize, we hand over to the execution team. Then they start align some vendors if vendor is required. So that way we are managing. Apart from that, being a technology head, we have to see like what are the things going on in the market. and right time we have to bring in. Otherwise, we will be behind in the patient journey, fruitful patient journey. If you talk about these days, SMS we are using only for OTP. If nobody is seeing SMS apart from OTP. So right time we have to bring WhatsApp, as Mr. Shivankar said. So WhatsApp everybody is seeing. Even if any WhatsApp not coming half an hour, you are just curious why it is not coming, internet not working or something. So we are sending notification on the WhatsApp for doctor as well as the patient. So such kind of technology evaluation, right, time to time it should happen. What are the things new available in the market, those things we are doing to increasing our care, clinical care, and this easiness for the patients.
Fantastic. So I'd like to share, and Bhupendra, thank you for sharing about your experience in Sakra and what you've done. I think the common theme from all the panelists was that, it's about planning, it's about organizing, it's about setting the goals and getting the objectives right. Now, my experience with this, couple of things I'd like to share as well from my experience. So one is that I was called in by a private equity firm for a very large corporate group to do a digital transformation roadmap. What I've seen is that exactly what Shruvankar said, the board was not very receptive. They said, all this is fine. You're giving us a 3-year roadmap. You want us to spend, X million dollars or rupees of 50 crores or whatever over the next 3 years. How do we approve such a budget? First, give us some quick wins. Just get your hands dirty, make that mobile app work. And then we will talk about this 50 crores budget you're talking about for the next 3 or 5 years. So what I've seen in my experience is that digital transformation is an investment. Technology is an investment. It's not tactical only. And hospitals have yet to realize that broadly. It is still not a board mandate, although it is increasingly becoming, as I was saying, the PE firm had called me in, it's increasingly becoming something that analysts are asking all the public hospitals, that how are you doing on the technology front? How are you making this better? Because everybody's realizing the importance of it. Another data point that I want to bring out is I'm doing a study right now on Indian hospitals, the state of digitalization of Indian hospitals. And here's the very, very optimistic finding. If you look at the current state of digitization of Indian hospitals, the average is below pass mark. It's below 40%. The aspiration of Indian hospitals for digitalization over the next 2 years is about 70%. So this is a student who wants to move from almost fail to a distinction grade. And this steep curve is being encouraged by the government through its Ayushman Bharat Digital Mission, and a lot of support is coming from the government to the entire hospitals on making this happen. They've put in place a sandbox and they're doing all these activities and encouraging through health incentives. So a lot of revolution is going to take place in Indian healthcare and digitalization in the coming years. And that's the last question I want to put to the panel. And I'm going to go the other way around this time, start with Bhupendra. What do you see if this sort of, bacha fail ho raha hai, usko distinction la raha hai, how do you make this journey? And what are the challenges you are likely to face and how are you going to overcome it? And I know you're going through this on a day-to-day basis right now, right?
Yes, yes, it is a biggest challenge. If we say in terms of Sakra, like 3 years ago we were here, now we were here, we are here, and then we are thinking to up to this level. So it is very difficult. Not only technology, many other resources also required in this, and to get those resources very challenging. Like one is, as you said, budget and right resource, right partner to bring the right technology. But
I make a slide, Nimak, here. Whenever we IT people are on the table, the CEOs have disappeared from the table always. Whether we are inside the hospital or outside the hospital.
if you approach the management or CFO, they say, okay. They listen whole story, but end of the conversation, they say, what I'll get from it. Correct? Means numbers. So it is difficult to tell at that time, like in numbers. We can say, yes, it will provide the better care, and enhanced experience to the patients, and this futuristic approach of the patient virtual care we can start. So all those things all together, now management post COVID start listening and understanding, and they are supporting as well. The hospitals which having the budget concept, they are doing much better, rather than as and when required story. So I worked both kind of hospitals, so I can see the difference between budget and as and when. For us, like the management is supporting and we are bringing our journey, but still right resource in the market is difficult to find out, and consolidated a solution, because we have the market is floating with the solutions, but it is not consolidated. Somebody is giving only appointment, somebody is QMS, somebody is EMR. So is in holistic way, or somebody is saying, sir, on top of your HS we'll give you mobile app, then integration, API, all those things become a roadblocker. If something goes wrong, then nothing will come in the patient app and all.
And like Derby Foundation has more and more digital health coming out. Innovation labs have more and more these companies coming out. All of them are coming to our table, and we have to integrate all these applications, right? That's what you're saying, right? Yes. It's one of the challenges. And the cyber security part, you were wanting to talk about that as
Yes.
well.
Even recent example also we have. So cyber security is the biggest challenge these days. Earlier, if you talk about like 5 or 10 years ago, hospital works within a hospital. They are not exposing anything on the cloud or internet. Now everything is on internet. So hope you heard AIMS and many stories is there. But recently, which we seen on the name of Sakra only, one patient, some 62-year-old lady, she was searching in the mobile, like ortho, who is the best doctor of ortho. Then Sakra doctor came, and she then disconnect her phone. After 5 minutes, she got a call. Ma'am, you were searching the doctor, ortho doctor. I am from Sakra, and I am sending the link. You can click on that link, and your appointment get booked with the 10% only. She not much aware about the technology, and she did. So that frauduler taken her some money from her account. Same way happen in Ludhiana, Mumbai, many cities. So the awareness about the technology uses should be penetrated to the end user. In this, there is no concern of the hospital side. Because if you search in anything in Google search engine, the hackers taken the paid service from the Google, and they can come to know easily what you are searching, and they can call you back. You are searching that then, and they can hack your account or mobile. They can steal important data. So 3-4 scenario recently we in CIO communities we come to know. So one thing, cyber security should penetrate to end user as well as organization side. Uh, Always we divide the security in two terms. One is local and one is external. External is cyber security. Local means our employee and if some guest is coming inside the organization. So in that segment also, like DLP, EDR, XDR, all those things we are bringing these days. Earlier, otherwise in old era, in healthcare, we are using one firewall, and then the end side is antivirus, those things. So yes, technology evolvement and adoption is getting increased. Challenge is cyber security is the biggest challenge these days.
There's a nice relationship between the two. It's something I've heard hearsay, but it's a very interesting point. The CFOs of many hospitals are holding bitcoins to pay off ransomware. They're holding that much money and paying that much money, not spending it on securing their technology and their infrastructure, but keeping it as an emergency fund of the same amount to pay off to the ransomware. That is the situation we have reached. It is, as you digitalize more, the risks go up. And you spend maybe 50 lakhs on the software, you're going to spend 50 lakhs on recovering from that ransomware guy, right?
Even we don't know they will decrypt the whole data or not.
Right.
After
right.
taking money as well.
Right. Forget the reputation risk and so on. Just a couple of minutes, we'll let Deepika and Shurvankar also add their points, because it's a very important point, especially in the Indian context. Yeah.
All right, I'll make this quick. Our journey of digital adoption started again 10, 15 years ago, and I was an Epic trainer and an analyst. Back then, I was fortunate to participate in what we call the unit of the future, which was the first unit. It was a cardiothoracic floor where Epic was being implemented. And our physicians threw a fit when they moved from paper to electronic medical record. But I would say, long story short, over time, because the government gave incentives for adoption of EHR, that the curve was easier for us, and eventually the incentives became penalties for not using. So that was one, and also younger physicians, younger residents, fellows, as they started adopting EMR, I think even the senior physicians had to give in. So I think age and other factors are also important when you consider digital adoption. I won't talk about security. I know we have very less time, but if you have any questions, I'm happy to chat after.
I'd just like to give one incident which I just heard yesterday. A patient was given a chemotherapy dose. There was a 5-year back neurological problem which was not reported and not available in the EMR in the hospital. The patient went through a shock and had to be removed from the treatment. I think doctors even don't understand here the importance of having longitudinal medical records. And the government is having to force it as it has done it in the US. And now there is an initiative to make that happen across the country. And Manipal being one of the leading hospitals working in that area, I'm sure you have to add to that on the longitudinal medical record.
So I'm not repeating what Bhupender already mentioned on cybersecurity and fraudulent, on particular URL, payment-based fraudulent. There are a lot of use cases are there. Even we experienced, personally I experienced also in different domain. And now this time I think it's a patient data protection law came in Indian government, and still the problem is our society is not built in that way. Basically, when you just go out from the hospitals, your prescription will be your local pharmacy, right? So entire data is outside. So whatever we are doing within our perimeter, it's okay. Now, like we are going to implement e-pharmacy for Manipal patients only, right? So we want to keep all those data intact. But the problem is the data will be outside definitely, because the outside pharmacy, all these shops are ready to give you on better discounts also and other stuff, and you will be giving your prescription, your data to that pharmacy. So your data is outside. So this is
I just want to remark that Manipal spends the largest amount on their IT and keeps the patient's record in the safest system known to Indian hospitals, I think. One of the leaders in keeping the security of the patient records. So we'll conclude here. Thank you very much. And thank you very much for your patience. I hope we, give you some insights of a technology point of view, what's required to build a smart hospital. Thank you.
Thank you very much to Bharat and as well as all of our panelists. It was a very interesting conversation. I'm sure there's a lot of questions from the audience. I myself have a few. So, but before I shoot away, I'd like to ask our audience, do we have any comments, anecdotes, questions? Yes. Can we get a microphone, please, if you don't? Yeah.
So as a consultant, usually we keep talking about smart hospitals, but the biggest challenge over last 4-5 years trying to implement this in couple of hospitals which I have faced is no software is full or being able to support everything. So to run a smart hospital, at least you end up running 15 to 20 different softwares who are strong at different places. So how do you manage to integrate them and get the better output? Because there's always a huge conflict that the data coming from one output is not a good data for the other one. So how do you manage that?
Yeah, before onboarding any partner or vendor for solution, we analyze means how many interfaces is required for this solution. So that is why I mentioned in my previous conversation, uh, consolidation is required from vendor side also, not in bits and pieces. Like if OPD automation, this OPD automation before this solution we implemented, 4 5 when partners approached us and we found it's in bit and pieces. Then we rejected and finally we reached to one partner. Means one is HIS, another is OPD transformation. Only two partner and one API integration. So that way we are managing. We are not like your solution is good, but like uh, one solution, second solution, third solution we'll integrate. No, we always ask vendor to do come back with the consolidation. So that way we are we focus first the how many integration is required for this solution.
So at our system, we had to do away with some of the legacy systems that didn't work for us because we had so much redundant data across the systems. So what we did was we mapped out the systems and we actually collected data from point of care systems as much as possible. So we are avoiding duplication. So I think integrating point of care data collection and then doing away with redundant legacy systems and adopting the newer technologies was what we did.
Already Bhupender mentioned, so nothing new. So main challenge is your core system. What is your core system for the hospital is, right? And that core system is able to interact with your medical equipments or not. That is also a very big important thing because nowadays medical equipments are coming, new medical equipments are coming. They have to be interfaced with your core systems. Unless they are not interfaced, you can't do the automations within the systems also. So that is more important. Other than this, yeah, there are the processes are there, approval mechanisms, all are there. Your systems, however, whenever you are choosing any systems, that workflow need to be defined and need to be tested on that particular core systems or not. Otherwise, except that core system, if you are taking any ancillary systems who are supporting your particular specialty, particular function, then that can be manageable. That is not an biggest challenge. But if your core system is weak, then it's very difficult to handle the whole scenario.
Great answers from all the panel. I just want to give an industry perspective. You are very right. This problem is stopping digitization from achieving the progress, and there aren't products that work well together. So as an initiative from the government, the National Resource Center for Electronic Health Standards run by CDAC has been working closely with the FHIR community, which is a global standard for interchange of data. And the FHIR community in India is meeting on a monthly basis for a few months now, and they are working closely with the NHA on adoption of these standards. And going forward, the government is looking at certification of all the products that are available in the market. So it'll give more chances of this integration working better at a system level. I mean, all these hospitals are doing individual efforts, but at the government level, this is what has been happening.
I think we have space for one or two more questions. Yes, please. There's Navdeep from our Alchi Design Studio. We'll be watching you a little bit later on. Navdeep, please shoot away.
Yeah, thank you. Great discussion. Thank you for the time. So we design and build healthcare products. So what is that one thing you would advise us who are building solutions in this space continuously? The one thing is this, integration and all that, but is there one missing piece, or if you want to tell us, like, what is that one thing we have to keep in top of mind while building solutions?
I'll go with Bhupendra first because you've been encouraging a lot of startups to come up with new things.
One thing is product. Okay, we buy a Maruti car, correct, and then we drive, but we don't know all the features. So in earlier forum also I mentioned, if we buying any software, any company software, if they include in their product like audit after the implementation, then it will be a robust thing for any solution. What happened? A product is by company A and implementation partner is B. Then the implementation partner did completely 100% this configuration, 90%, 80%, we don't know because we are not expert. Yes, we bought the technology and we are implementing in our organization. So the OEM should bring, they can keep the cost for the audit purpose, but their product will be then give the 100% outcome for the organization for the purpose which we bought. So this, I feel this OEM should include it.
I think we all have to just remember to not break something that's already working. So when you're bringing in new technology, I think it's important to check off the boxes as to what is this technology adding value to. Is it improving the efficiency or outcomes, or is it providing safer care? I think those are just the overarching themes that I would always urge the technology companies to consider.
Nothing. I don't know what product you developed basically. If it is a complete enterprise product, then definitely you have to go through, and how you are proposing. If it is a SaaS model, you have to cross through all the cybersecurity norms and everything, right? And if it is a use case based product, maybe some use case you are covering on your product, then what my experience is basically startup to startup, they don't talk. Basically, there is a monopolism in the market that need to be, handled. Basically, it's very difficult because if I onboard you for a particular use case, then maybe you have to talk to other startup also.
So we are in the service providing space where we kind of build products for many startups.
Okay.
So that's the main.
Okay. Thank you.
One thing I've seen is a lot of people build demoware, and when you put it into production, it doesn't work. So just be careful. Don't build products that are good in demos but don't work in practice.
Okay, thank you very much. And as the MC for the conference, I will take the liberty to ask you the last question directed towards you, Mr. Bharat, as well as Mr. Bhupendra. I found it extremely interesting when you said that Toyota, the world's largest automobile manufacturer, wants to get involved and collaborate with Shankara Hospitals.
Sakra.
Yeah, yes.
They own the hospital. They have equity holding.
Oh, you're the owners of the... Yeah, so that was in fact my question. Why do they want to get involved in the hospital? Why does an automobile company want to get involved with a hospital? It turns out that they are the equity holders.
Oh, I think that specific question, Bhupendra is the best person to answer.
Yeah, and also why Toyota? Why, if we're looking for a big Japanese firm, we can go with maybe some technology firm, maybe Panasonic. And if we're looking for an automobile firm, why not Honda? Why Toyota? So what's the backstory of this?
In Japan, Toyota have some major breakdown in their plant, and many employee got impacted due to that. So they came with the thought, shall we have our own hospital in each country like that? So Toyota main this factories and all nearby Bangalore only. So they came up with the one hospital chain is there in Japan, Sicom. So Sicom, just like Fortis, Apollo, Manipal in India, it's a series of hospital they have. So they came along with Sicom and formed the hospital in India. And then they promise like they will bring the technology-enabled hospital. So if you talk about in rehab, we have a robot. Ortho, we have a robot. Neuro, we have a robot. So robotic surgery, non-robotic surgery, and this technology, IT segment also, they are increasing. So believe in technology, bringing and serving their employees. Main focus was that only. But now the Indian patient and even abroad patient also we are serving. So one incident happened with the Toyota in Japan. So that is why they came into this segment.
So despite having no direct experience in the healthcare business, Toyota has been able to add immense value to the business.
Yes, yes.
I can give a more generic response. So globally, Walmart and there have been others also from other sectors coming into healthcare precisely for the same reason that he was saying, that they have their own employees and they want to provide them healthcare through these outlets. And they want to bring in their domain experience, like their capability in retail to healthcare, which is what Walmart is doing. Not all of these have been successful. Many of them have not been successful because healthcare requires very specialized knowledge. But I think the moment each one of them comes in, they teach the existing hospital groups a lot of new things on how to do things better. The Korean hospital that I mentioned, it's Samsung's hospital.
Samsung, yeah. Yeah, Samsung is in fact renowned for that. Samsung City. Okay, thank you very much to all of our panelists for sharing with us your immense knowledge and experience. It was an eye-opening discussion, and we look forward to connecting with you again offline. Thank you. In fact, we heard on all of this discussion about smart hospitals and hospitals of the future, and we heard also from Navneet a short while earlier. It so happens that Navneet's firm, Alchi Design Studio, is designing an app to assist with this smart hospitals. I'd like to show us a short video, not more than a minute long, about what they're doing to enhance the smart hospital experience. Can I request my AV team to please roll the video? Before our next discussion, please watch the video. About a minute long. So that is an app to reach out for hospitals and healthcare facilities to reach out to patients and customers. And it so happens that our next chat and discussion is going to be an extension of this, this topic. You know, we are now living in a situation wherein virtual meetings, online meetings, telephone meetings are the norm. You know, we don't meet as often. So there are new delivery channels for that healthcare facilities will have to look at. Now, what are these new healthcare delivery channels? And let's explore them a bit further so that we can really tap into the potential that they have to offer. To discuss this topic in more detail, we have three panelists, and I'd like to welcome them on stage, starting with Mrs. Manisha Kumar, the Regional COO of HealthCare Global. Our next panelist is Mr. Akshay Oleti, who's the Business Head of Fortis Healthcare. And to moderate this discussion, please help me welcome on stage Dr. Balakrishna Shetty, who's the Vice Chancellor of Sri Siddhartha University. So as I was describing, what are the new healthcare delivery channels? How do we explore the potential and ensure that the patient experience at the end of the day is seamless? This is a fireside chat, and it's over to our three panelists. Thank you. Over to you.
Well, we had a lot of discussion starting from healthcare materials. Then we had a discussion on smart hospitals and hospital design. Now we have come to discussion on healthcare delivery channels. Of course, in the last 2-3 years, we have seen revolutionary changes in healthcare. Basically, because of the pandemic, I would like to say when the patients used to come to me, and when I used to do a lot of scans, I had to describe them. This is the liver, this is the kidney, this is the heart. I used to describe the body. But today, patients ask me, sir, forget about the body, tell me how much is my antibody in my blood level. That is the question we are getting now. That is the awareness which has been created because of the pandemic, and almost everybody knows what's happening in the healthcare. Now, coming to this point again, so what is important is starting from the definition of healthcare. Now, recently we had International World Health Day, and the definition says health is defined as complete physical, mental, spiritual, and social healthcare, not merely the absence of disease. But this definition is also changing. You know, there are so many changes in healthcare definition. There are so many changes in healthcare systems, and so many changes in healthcare deliveries. I would like to say, like, when we ask sometimes, and the two things which we face a lot of challenge in this thing is, like, you know, if I ask somebody to give a urine sample, recently I had this problem. I told them get a urine test, and I get a call from the patient. She's only about 34-year-old female. doctor, and this Google says that you have to collect midstream sample, then I had to describe her how to collect the midstream urine sample. So these are the questions, like WhatsApp University is giving us a lot of challenges, and similarly Google Doctor is giving us a lot of information. So to discuss all these challenges in healthcare deliveries, we have got eminent speakers here. And first of all, I would like to introduce Manisha Kumar. She's Chief Operating Officer of HCG, and she's also connected with the government of India regarding healthcare deliveries. So Manisha, the first question to both of my panelists here is, uh, everything is changing, but the first thing is, today we discussed, the most important thing is preventive healthcare. Okay, they said vaccination is the most important innovation in the healthcare facilities as far as the healthcare industry is considered. So, starting from primary healthcare, what are the new healthcare delivery channels as well as the primary healthcare concerned?
Yeah, thank you, Dr. Shetty. As you rightly said, there's a lot of disruption that has been around, mainly because of technology. I think a previous set of panelists discussed this in detail. It all got amplified because of COVID pandemic. Overnight, we had to not resort to technology. Overnight, technology came to our rescue. So we were able to cater to a lot of patients. And I think it dispelled the myths that existed before. The myth that the learning curves for adopting technology are huge. We will run into glitches, we will lose access, and so on and so forth. And a lot of acceptance got created by doctors, by providers, and also among patients for using this. Now, as tertiary care providers, is it important for us to focus on primary healthcare? Yes, most definitely. I think smart hospitals today, what we want to do is we want to create a digital front door for all our services that can be taken out of the hospital ecosystem. Now, creating a hospital is an expensive affair. Every square foot of infrastructure in the hospital comes at a cost, and a lot of services, especially in the OPD ecosystem, can be taken out, and that entire ecosystem can actually be created digitally in say patient's smartphone, and a lot of those services can be managed. We did this in COVID, we continue to do in a lot of cases, and I think that is the single largest disruption that will not just open up space for us and ease patient care, reduce cost of care for the patient, but also just make enhance quality of care and make create the continuum that is so much needed. We have dropouts in follow-ups. We have patients who are not on top of their continued care, reassessment, retests, simply because it is so expensive, time-consuming to come back to the hospital or the clinic and see the doctor. So that is one. And in my role with the government, we heard about National Health Mission and so on. So government um, is envisioning a National Health Mission where there'll be about 10 lakh primary healthcare centers across India. And the idea is to have a healthcare center within 2 to 5 kilometers of radius from each and every household across the country. Now, what will be important really to implement it on ground, given so many challenges we have in terms of having basic IT infrastructure, basic internet connectivity in so many areas, skilled manpower of doctors and nurses. I think the key focus of the government and for us as policy advisors for them is, one is to be able to create intelligent networks to keep medical devices, but to be able to integrate them with digital advents using internet connectivity and so on, so that all the information is captured in a seamless manner, creating unique health IDs, pretty much like health passport for every single individual, and creating systematic e-health records which can migrate environments. Today, a big challenge is interoperability. So we might have electronic health records from, say, Manipal, and then we go to Sakra, and then it's a whole new environment, and it has to be created from scratch. So getting that interoperability across all PHCs across the country, so that there is fluidity of data is maintained when a patient goes from a city to another and so on. And the third, of course, is skilled doctors and nurses, which we know is hard for us to find as it is, and think about the government machinery. And there are a lot of upskilling uh, of paramedics, of peripheral healthcare workers, like we have ASHA workers, we have auxiliary nurse midwives and nurse midwives who can upskill and actually can reach to the level of a frontline, hospital nurse and look at triaging and basic diagnosis of patients. And here also a lot of technology is being planned to be used for augmenting e-learning and virtual learning for such frontline employees to upskill them so that they come to the next level and can start looking at acute patients also as needed.
Thank you, Manisha. Thank you very much. So that's how you manage your patients in primary healthcare, and also you spoke about the tertiary healthcare. And we also have a great speaker today, and he's business head of Fortis Healthcare, and Manish Oleti, Akshay Oleti here. So Akshay, we speak about as a vice chancellor, we speak about us also as an industrialist, we speak about industry 4.0. And also education, we say education 4.0. Now I'll say this is healthcare 4.0. Okay, so as a business head of Fortis healthcare system, we have a lot of challenges for the patient as far as diagnosis is considered. Like let's say the patient will come, let's say if I ask a patient, you should walk for 150 steps or 2.5 kilometers, he'll say, sir, my smartwatch has told me that already has walked so many miles. And if you tell him everything, the smartwatch, the smartphone is everything, I would say it is a healthcare 4.0. And that's the one question. And second question is, as a business head of a private organization, what are the challenges you are facing in delivering the new healthcare products in your hospital?
Thank you, Dr. Shetty. So, to address your first question, at Fortis Hospital, we are working on a product which is used for our preventive health care. And this one is typically when you go to a hospital and you want a health checkup package, what you get is an array of products that are predetermined. There is an executive checkup, there is a master checkup, there is 4 or 5 other checkups, but then you don't know which one is required for you. And if you have a specific problem and you know about it, you would not take that health checkup and you would rather go into a doctor's room directly. So what we are doing this, changing here is that we are customizing the entire preventive health checkup mechanism for that particular patient. So we are asking a specific survey before we choose a package for this patient. And this survey will be a basic set of 10-15 questions that will help us understand what is the current lifestyle that the patient is having, what are the changes the patient is undergoing, and what would they like to understand about their body better. What has happened after the pandemic, as explained by both of them, is that the patients have started understanding their bodies much better. And as somebody who is a 35-year-old gym trainer is very different from an IT professional who is a 45-year-old and having a sedentary lifestyle. Now, basis this lifestyle and basis their habits, somebody is drinking, somebody doesn't smoke, and various kinds of habits, we can specifically customize what are the tests that can be done that will be more relevant for them. Instead of, now you see ads when you browse that you can get 100 tests for 499 rupees, right? So you don't know which of these tests are going to be relevant for you. Do you even need 100 tests, or can these 5 tests be enough for you to determine where exactly you are and what are the problems in your body so that you can go to the next level, right? So this is something that we are developing because healthcare 4.0, like you said, is going to be specific healthcare for each of us. Each of us in this room, imagine walking through the same room but getting very different kind of healthcare treatments and care based on what your requirements are. And that is something that is where healthcare is evolving and what we are working on. And when you look at the number of teleconsultations, it became such a big hit in COVID times. I'll give you an example of my hospital. During a day, during peak COVID, we used to see 500 to 600 teleconsults every day. And most of these questions, anybody who's having a simple cough, simple cold would reach out to teleconsult, irrespective of where they were in the country or even outside. Now, post-COVID, what has happened? This number has dropped to less than 50 a day. Now, I have an example of somebody from Ranchi saying that the doctor is telling that, yes, you can visit me first on WhatsApp or one of our softwares that we have for consultation. This patient says that, no, 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 I have a direct flight to Bangalore. Let me fly down to Bangalore. I will have a lot more comfort with the doctor when there is that physical presence, when there is that touch that is there. So we always thought that, okay, the bank tellers were replaced by the ATMs. Very soon the doctors will be replaced by robots. But that hasn't happened. Patients still feel the need for having that personal touch because healthcare is not something that they are willing to let go as something that let there be a technical interface between us and we will go. Obviously, if you put them in a corner during the pandemic, they will be forced to do that. But the moment you remove the pandemic constraint out of their lives, they want to come to the hospital and they want to have a physical thing. Now, for a hospital, this is a major challenge because we would want to reach to as many people as possible. As Manisha was telling earlier, with limited square feet space, we want to see as many patients as possible. We have set up so many teleconsultation centers right after the pandemic, but then the demand for these teleconsultations have lessened. But the good thing that has happened is more and more people now look for a doctor online, now understand their symptoms online. So now we are also able to reach out to them online. We are able to build those connects better. Earlier, the spends that we were making on the digital platforms were maybe 20%, 30% of our total spends to reach out to the patient. But now it has crossed our physical ways, and now we reach out to the patient and we spend over 75% of our overall marketing spends on the digital platform because we know patients are actively looking at the digital platform to reach out to doctors. And this is something that we are overcoming, and this is constantly evolving, and we don't know what will happen in the next 6 months. We don't know how the situation will be, but hospitals have been made to get on their toes so that they can handle this better.
Very good, Akshay. So you mentioned about teleconsultation. I also went through that details. Like initially it was about 1%. Now it is that is almost whopping of 40% teleconsultation going across the world. Now another thing with the teleconsultation, as well as this question will be again to you, teleconsultations and telemedicine and teleradiology, and the patients are coming with their own diagnosis. Like say, like I have done so much of exercise, they only tell you, I've got so much of my fat in my body. The patient only will tell you, this is my BMR, basal metabolic rate, this is my body mass index. All those details are given by the smartwatch or maybe by the telephone, by the mobile smartphone. So the healthcare delivery channels, like what you speak about, the modern healthcare delivery channels, the healthcare diagnosis is done by your mobile phone or your smartwatch. And when the patient comes with a diagnosis, I think the future diagnostic modules of our patients will change in the future. What is your opinion on that?
Absolutely, yes. And more and more people want diagnosis sitting at home using smart wearables. Now we know that watches are able to take care of our SpO2, which was something we didn't even hear about on a regular basis pre-COVID. And ECGs and any variations in the ECGs are directly alerted to your clinician. You don't even have to worry about who is going to take care of this. Smart wearables are going to be the future, and it is going to get cheaper and cheaper as more and more volumes pick up. We're also working on one such wearable which will be used for, it is a wireless device that you can fit on your body, on your chest as well as on your wrist. And on a real-time basis, it can not only tell your ECG, it can also work on your echo, it can also work on all these parameters and create something called as an early warning score. Now, this early warning score will immediately identify. Now, typically in an ICU, what happens is there is a large chart in which the nurse marks in, okay, the SpO2 is at this level, the oxygen is this level, the pulse is this level, and all these things are correlated. And post, let us say, an incident, an MI or a heart attack happens for this patient, then the doctors go through the past and see why wasn't this alerted, because the body is continuously sending signals to the monitors that there is an indication, there is a warning, there is a eventuality that is going to happen. as long as it is on paper, we will never be able to recognize it. Now, these wearables and all they need is a Wi-Fi connection. Our softwares are able to determine whether this patient 6 hours later or 12 hours later is going to go through an heart attack. And we now have started using this for our patients coming right out of the ICU, so that any kind of issue, we can immediately put them on a ventilator or move them back to the ICU. So these things can be used at home also, and very soon this will be the future, may not be even decades, only a couple of years, we will see this happening to all people, maybe who have a condition, who are beyond a certain age, asking and demanding this wearable, which you can buy at a shop for 500,000 rupees, and that is going to be the future.
Yes. Thank you, Akshay. Manisha, now you are managing one of the largest oncology groups in India, that is HCG. And as I told you, Healthcare 4.0, there are so many changes as far as the oncology. Oncology is one of the, I would like to say, one of the greatest non-communicable diseases which has to be managed. Still, don't know where we are landing with the oncology management, cancer management of these patients. So we think of a lot of targeted treatment for oncology, like let's say gamma camera or whatever it is, even though oncology is considered as a systemic illness. Now we see a patient nowadays, we can see, imagine a patient lying down the bed with so many, robotic prongs, hanging around, and the surgeon sitting somewhere around. And, these robots are doing most of the work, and surgeon is relaxing and finding out whether it's happened properly or not. Do you think this will be the future of healthcare delivery?
Yeah. So 2 points here, Dr. Shetty. One, you are very right that cancer is, of course, very sensitive, but I think in terms of innovation, is probably the fastest growing field and modalities across all the specialties. I've worked with multi-specialties before, and I see the depth of innovation in oncology is far more, to be honest. What we try to do, and I think Akshay inferred to that as well, is that the method of delivery of care is becoming more and more patient-centric, where there isn't a one-size-fits-all approach that conventional treatment pathways dictated. The patient comes, goes for chemo, or perhaps goes for onco surgery, and then goes for radiotherapy, and that's kind of what it is for every patient. And few standard chemo drugs, cisplatin, etc., those are given for all the patients. But now the approach world over, and what we practice in HCG also, is that it's more and more tailor-made, customized for each and every patient. So when a patient comes, we have a focused multidisciplinary team of doctors that first do precise diagnostics. And it could be nuclear medicine, of course, driven. We have high-end genomics now. We have AI-based molecular diagnostics now. So with that, first a precise diagnosis is made, and then the treatment pathway is very specific to the need of the patient. It could be a specific targeted immunotherapy. It could be a gene therapy with a gene blocker. It could be a robotic surgery. It could be a AI-enabled adaptive radiotherapy. So while we have these technologies, we have invested as a company and got the equipment, got the manpower. We have arrangements with a lot of leading pharma companies world over, and we constantly do clinical trials with them on the most innovative molecules. But as a way of looking at each and every patient and approaching the treatment of each and every patient, I think this itself is a disruption in the way healthcare is being delivered. It doesn't need technology. It just needs buy-in of doctors across specialties to sit at a common table and to come to a consensus, and then to take the treatment like that. It involves our radiologists, our pathologists, histopathologists, and of course surgeons, medical oncologists, radiotherapists, and so on. In terms of technology replacing, definitely there is nobody that can replace a caregiver. And more and more, as days progress, we will need more and more doctors and nurses going forward. So that need is always going to increase, exponentially increase. For example, you mentioned the robotic surgeries, or let me take an example from radiology, you being a very senior radiologist. So we have worked with one of the largest medtech companies in the world to co-develop an AI-based radiology imaging system. Now, what the radiology imaging system does is it uses AI, and when the scan has happened, it auto contours the tumor. So the first level of reporting, which we had a junior radiologist or our student do, now that in a way can be taken back because the AI in the system itself has auto contoured the tumor and has showed the tumor. But then again, we will have a radiologist, senior radiologist, or a mid-level radiologist sitting and reviewing it, validating it, clinically correlating, and then reporting it. So how does it help? One, it makes the process faster. It removes, probably, I wouldn't say duplication, but probably multiple layers of reporting or approvals which were happening earlier. And of course, it is precise because it doesn't leave any margin of error for any a clinician or a technician over there who could have probably made it. So this is one innovation as an example which augments the clinical expertise and augments the diagnosis rather than replacing it.
Yes, yes, very good. So I think we have finished the discussion with both the speakers today. What I would like to say is healthcare definition is, almost it is changing. But even with the COVID, we have seen COVID is, even though it is just a viral disease, we have seen the mortality in patients with the reduced immunity. So the immunity now, everybody is feeling that immunity is a game changer. So everybody is finding out how to increase the immunity of each and every patient, every person here. So I think more people are going into natural health, yoga, meditation, and how to improve the immunity. And the more and the emphasis on most of these hormones. Let us say initially we used to think about insulin and steroids or something like that. Now we know that we need to increase some of the basic hormones in the human body. One is, I would like to say, that is the immunity increases with the, they say that body immunity, it doesn't depend on what is the treatment you are taking. It is all, most of the diseases are endogenous. Initially we thought all the diseases are from agents like virus, bacteria, or something like that. But we know today that the most important diseases are endogenous. They start from within. So if you have to avoid the diseases from originating from within, we need to do so many things. That is what is actually discussed with other previous speakers. That is a love, affection, and energizing, and the motivation. So with the motivation, love, and affection, I would definitely say the immunity of each and every patient will increase. We need to speak about, we speak about one hormone called serotonin, which increases when you serve others. And also we speak about another hormone called oxytocin, which increases in a human body when you show love and affection. And we also talk about something called a dopamine, which increases when you achieve something. So the human health doesn't depend on exogenous medicine. It depends on endogenous hormones like serotonin, oxytocin, and dopamine. And these will increase in the human body when you show a lot of love and affection and when you serve others. So these are points I would like to say. So today, healthcare delivery is prevention and preventing diseases. Preventing diseases is doing your own jobs and your own service to humanity. And I think that will increase your humanity. So this is our discussion, and you can take over.
Those are profound thoughts, Dr. Balakrishna, not just for the conference, but profound thoughts for us to take even outside the conference. When you focus on self-development, self-improvement, improve your physical state, mental state, very importantly, that will automatically boost our immunity system. So that's very, very profound. And thank you very much for sharing that insight with us. In the interest of time, and also because the networking session is just a few moments away, we will reserve questions, comments, anecdotes, etc. for the networking session. Yes? One question from the audience? Okay, one question. Of course, from Bharat.
Thank you, and very interesting discussion. This, Dr. Shetty, this whole thing about Father Paul from St. John's had taught me, you've got to think about meaning and money. It can't be one of them, right? When we talk about preventive care or even continued care, one of the things that I encountered when interacting with large hospital groups was that where's the money? Unfortunately, the margins in preventive care and margins in even post-operative care are not good enough for most private equity investors. and they pull away hospitals from doing that. How do you hold that fort? I just want to hear from you. It's a very difficult battle, from what I know.
Yeah, I'll take it if you allow me. So, Dr. Bharat, this is not an easy question, and I don't think there is going to be an end to this conversation in this stage. But I can give you a reason why preventive care and things that might not directly give us the margins would still be of much use. There is a lot of mind behind why we work on so much of preventive care, because and multiple hospitals, multiple private hospitals which are for profit have also started working on preventive care on an aggressive manner, because more and more hospitals are realizing that when you are looking to reach out to a customer when they are not well, it is too late by then. You have to look for people who will trust your systems, who will strive by you for any kind of healthcare, whom you will be on top of mind recall for any kind of healthcare related concerns. If you take the Kaiser Permanente model in the United States, what they do is something that we have started replicating in India, but in a very slow manner. They manage the health of people. They are not just responsible to manage the illnesses and provide treatments. What they do is they say that if this community is healthier, the government pays them a certain amount of money to keep the community healthy. Now, if you want to keep a community healthy, it is not that once I get a critical illness, whether it is a illness pertaining to the neurology or to oncology, doesn't matter. The cost involved in maintaining the health of a person or the community is much higher post-illness and much lesser pre-illness. And that is the reason preventive healthcare is going to be more and more important. The governments also have to start looking at it in that model. But here in India, where the government is not proactively looking at community health as of now, and hopefully with initiatives from what Ms. Manisha told, those things will start happening. But from this point of time, at this point of time, what we are looking at is being at the top of mind. That is why our preventive healthcare division will be the first thing that a patient would see as soon as they enter the hospital, because we want patients to get a feel of how good the services of the hospital are at the preventive. If we can do preventive health excellent, I'm sure they understand that the post-illness healthcare also would be even better. And that is the basis in which we are building trust, loyalty through these factors.
I would like to conclude. Basically, I would like to say none of our medical textbooks so far has mentioned about preventive health. Believe me, okay? They don't mention, they just speak about management and treatment. Maybe some of the Ayurvedic textbooks may mention about prevention and maintenance of health. And believe me, corporates, whatever said and done, they will never focus on preventive health. Preventive health will be totally individualistic. Okay, my health is in my own hands. I think we have to follow that principle. And I don't think if you have invested money into tertiary care hospitals, I don't think we'll be focusing too much into preventive health.
Just one point to add from my side. I think we can.
Sure, I agree. One
Yeah.
short question.
I'll
No,
just
one
add a
short
point from my side.
Of course, I agree, 100%. No, please. Can we have the mic? No, please, I insist. You're right, 100%. The idea is to interact. The only you can interact was networking is short now. Please, I insist.
My name is Suraj. In fact, the question, I raised my hand, but the question was asked. It is a continuation of his question, very relevant question. Okay. So, Mr. Akshay, you are a business head. So, does this healthcare awareness creates anxiety and drives more people to the institution? Is that what is happening? I feel that because, there are sponsored ads in the TV from, I don't want to name, institutions, bigger institutions, medical and healthcare institutions about living healthier and, eating breakfast on time, about, don't go to the hospitals. But, Post-COVID, this has happened. When a patient search online about his symptoms, he becomes more anxious and he just wants to take the car. No teleconsultation. He wants to sit in front of the doctor just to hear him say that, okay, like I'm fine if I'm the patient. That is one. Second, does the teleconsultation, more teleconsultations, would you promote that? Because that will affect the other incomes, the pharmacy incomes, the cross consultations and other things.
I would like to say that I would like to answer that question. As long as this particular definition of healthcare, that health is defined as complete physical, mental, and spiritual health, I think your point will stay that apprehension of patients will always be there, that advertisements. But today we are redefining that healthcare. Today we say health is defined. Any person who gets up in the morning and goes to work, he is a healthy person. Because if I find out in this particular room, some may be having diabetes, some may be having hypertension, some may be having cholesterol, some may be having triglyceride. That doesn't mean that he is unhealthy. A person who works is healthy. A person who doesn't go for work is unhealthy. That is a definition of health. As long as you go to the Western definition, there is a chance. I always tell them, if any person who is lying down in the bed in the early morning is unhealthy, he is a sick patient. So we should not worry about these diseases as long as they say, as if you can get up in the morning, if you can go to the toilet in the morning, if you can get a good sleep in the evening, you are the healthy person. There is no definition at all. But if you consider those Western definitions, there is a lot of cause for apprehension, and you think that, and again you go for multiple health checkups, that cholesterol, triglyceride. We said for centuries we are working on cholesterol. We said it is totally useless. Now again, diabetes, blood sugar, whatever we say 100 milligrams, that is also not very important. So the body makes its own changes as and when required. So it wants more cholesterol, it will raise the cholesterol. If you want more sugar, it will increase the sugar. Only thing is you get a test and you will get a, that you are a diabetic patient, you are a cholesterol patient, you are a hypertension patient. So this is a tagging we get just because of all these indicators. But if you can work very well, I think you are a very healthy person. And these apprehensions created by all these telemedicine, teleradiology, and all those advertisements, it will continue. It is left to your discretion to find out whether you should follow or not.
Very well said. Why complicate matters? Often less is more. If you're able to rise and go to work, you're healthy. Why bother with anything else? Very simple, yet very, very profound once again.
If you enjoy that work, you are happy.
Exactly. Yeah. You're not only healthy, and if you enjoy the work, you're happy. I think, it's so simple, it's so brilliant, and very well said. Thank you very much. Any more questions or comments or anecdotes or any kind of interaction? Yeah.
I had a point to what Dr. Bharat said, but I liked your questions, very interesting also. To your point on whether private equities would invest, PEs running hospitals, and would they be interested in investing where they see less margins? To be honest, no, and which is where technology is a great enablement for us to be able to take it out of hospitals. So in cancer, for example, we don't assess with the ticket size of patient's admission. We look at the lifetime value for a patient because it's a lifetime disease. We like to stay engaged. We like to ensure they come for follow-ups. So we, for both matters, for both reasons, want the supportive, post-operative, and the continuous care to be at home, which is where we would more and more want to use these technology enablements. And yes, in India, things are changing, but slowly. Unlike US, where the payers have a vested interest to keep people healthy, we are not as much payer controlled. We have even mature hospitals like Fortis, HCG, we only have about 30, 35, 40% of our patients coming with insurance. The others are pretty much out of pocket. That is unfortunate. Government, all our doctors, textbooks, everybody is looking at curative even now. So there are some private companies that are trying to consolidate as HMOs, as ACOs. They're looking to work with government. And once we have a firm structure around it, maybe we will reach a stage, a decade down the line, where there would be HMOs. Already there are private corporates who are looking at outpatient coverage for their employees and trying to ensure that they are healthy, they don't fall sick. There is a lot of tech that is disrupting the market, and it's getting more and more structured. Now the government is kind of looking at it. I would say it's about 8 to 10 years away from consolidating the way it is in US with HMOs and PPOs, and then it would make sense financially, make it more viable for all of us as well.
Last question to the gentleman at the back.
Hello, Ms. Thakur. Gentlemen, this is Bala Subramaniam from HPG. I just have one question. I'm asking this question at the risk of I might be cancelled, but I have to ask this. Since the gender crisis is already devouring the West, how is Indian healthcare ecosystem is preparing itself to mitigate it in ethical wise as well as market opportunity wise? Because it's already marked at little over $2.1 billion. So that's my question to you, to the panelists.
Can you please repeat the question?
I said,
What is devouring? I think we missed
so
that.
gender crisis, the gender reassignment surgeries, gender reaffirmation surgeries is already taking over the political Western hemisphere. It won't take a long time to reach the shores of our nation. How are we prepared to take it on, if at all we intend to? I don't know. I don't want to make a political comment on that, but how do you see that from ethics point of view as well as market point of view, market opportunity point of view? Is my question clear?
Yes.
Thank you.
Now it is.
Okay, so I don't think it is new to India. While you might think that, okay, in India you have not heard about gender reassignment surgery, even at Fortis Hospital we regularly do that, and with excellent results, and we haven't faced any kind of legal issues. We are compliant with all the statutory requirements. So,
I was not asking in terms of legal. So I totally understand that the biggest LGBTQ community comes from India, but we have a tradition attached to it. We don't force it on people in terms of an agenda because it's already happening in the West. So how are we prepared to face it when it comes more of a propaganda, and like in terms it also is penetrating into academia?
see, at this point of time, I don't think any of the doctors or hospitals are judging people here. There is already a lot of stigma in oncology. There is a lot of stigma in various other diseases, right? So even for an IVF, there is so much stigma. But hospitals and doctors are here not to judge patients, and that is what is being taught in all our medicine books as well, that we judge a patient by the needs, and as long as law allows it, we do it. And propaganda will always be there on the sidelines. There are always various other types of treatment which we know for a fact aren't effective, but hospitals just focus on the work that they're doing, doctors just focus on the work that they are doing, and at this point of time at least, that doesn't affect us, and we don't see it affecting us in the future as well. I think this is a problem that we will have to face when we have to cross that bridge. I don't know if we have any other opinions.
I agree. I don't think any of us has done a market sizing yet to get an estimate of what is the potential, how many patients can we likely have. For example, how we have a market sizing for say diabetes, cancer, and so on. But I think one is that we as a society are very open. We recognize all the genders that are being recognized globally. I think in terms of providing equitable access to care, there is difference between equity and equality. And in terms of giving equitable access to care, there are initiatives that hospitals are taking. We ourselves have taken, we have made special, preventive care and diagnostic care packages for transgender communities in all our tier 2, 3 hospitals. So that is something we have done to kind of, and it's not just transgender, we have done it for several communities who we feel are on the margins of society and may not have as much access as the other more privileged people do. So that is something we are looking at, is just to make inroads for them to make it more approachable and easier access for them to come to hospitals. That is where we are as an industry now. And of course, there is technical capability already exists, like he said, and there are surgeries, etc., that have always been happening. But yeah, no targeted market sizing or no real potential of this segment sizing has been done.
Thank you all very much. Good answers, and of course, good question as well. Very well answered, Mr. Akshay. It's a stigma only if you want it to be a stigma, but actually, it's all in the mind. So very well said. And thank you very much. And thank you all for your participation as well. Can we please have an appreciation for our panelists? And thank you all very much for sharing your experience with us. Okay, so some of you might have noticed at the back of the hall and at my left side of the hall, we have our partners who are exhibiting the newest and latest innovations available for all of us to use when we're building hospitals. And we're going to have a short presentation from two of our partners back to back. And we're going to start with Mr. Amrita Subhash, who is the Ceiling Solutions Specialist at North Ceiling Solutions. So please help me welcome on stage Mr. Amrita Subhash for a short 10-minute presentation on what are the various ceiling solutions that we are on display today. Over to you.
Much for a very valuable presentation and interaction from the morning. So I'm representing Knopf Ceiling Solutions. Earlier it is called as Armstrong Ceiling Solutions. I'm taking care of. My name is Amrita Subhash. I'm taking care of technical support and ceiling solutions for South and East India. So today the agenda is what are the challenges generally we face in the ceilings in the healthcare facilities, and what are the probable solutions. And there are some newer concepts and newer solutions to the existing facilities as well as for the upcoming new infrastructures. Yeah. So first we see what are the general problems faced by the patients. Actually, we are making the healthcare only for the patients, right? So what are the common problems that are all faced by the patients? Number one is the key property is the acoustical property, right? So even in this particular hall, I don't know how many of you have noticed there is some acoustical issue or some concern is there. So from morning 9:30 or 10 o'clock, we were sitting in the room. If you count the measurement of the sound range, which is varying from 50 decibels till the 80 decibels and more. And for a normal people like us, how much it is making some kind of a stress because of the improper acoustics. So consider about the patients, how much it is important for the patient is already ill and he has come to the hospital for the treatment, right? So it is very, very important how acoustics is important in every spaces of hospital. Number one is reception. Reception is actually a kind of one critical area where all the the OPD patients, their relatives, and even the buildings and counters, everything would be happening. So at this particular area only, all the the sounds would be created, and there are more chances that it can be spread across to the other floors and other segments of the hospitals as well. So at this particular area, so we need to address or we need to create the need for some acoustical treatment for the reception or billing counters, number one. And number two, maybe at the consultation rooms for the OPD. So whenever we are having a conversation with the doctors, our privacy is very, very important. So the sound which has been, whatever we are discussing with the doctor, it shouldn't be, overheard to the next room, or by the meantime, it should be having a speech intelligibility also, so that whatever the patients were talking, it should reach rightly to the doctor and vice versa. So it is very, very important when we are making a OPD consultation rooms. So we need to have the proper amount of sound insulation as well as the sound absorption also. So that is a second need which we need to look out when we are creating infrastructure. And number three is that the corridor. Corridor is one very, very important place where the sound from the pathways or from the passages, it can reach to the wards or it can go to the treatment rooms or it can reach to the your patient wards. So it can be vice versa. So even at this particular area, we need to have the proper acoustics. See, apart from acoustics, one more important parameter is that the light. Light means the sound glaring shouldn't happen. See, we are all normal human beings, but when it comes to the patients, and especially for the corridor area, then generally they would be in structures. So when they are taken in the structures, they would be directly seeing the ceiling, and the ceiling glare or the light glare shouldn't affect them. So our general request for the designers, otherwise for the hospital owners, is that we need to consider that lighting mechanism in the corridors area, so that there shouldn't be any kind of a direct lighting. There should be only indirect lighting, right? So there are many number of ceiling solutions available to facilitate those kind of requirements. So we can go for some indirect lighting, so that the light from the sideways, it can indirectly it can fall onto the patients, so that it will not stretch there. And very importantly, if you see the measurements, sound measurements at the reception areas, nowadays, it is going beyond the required level. As per WHO, there are some limitations for each and every area. Suppose if it is for reception, or for the treatment rooms, or for the consultation rooms, the rating is in a such way that it can be the background noise level, it can be 30 decibels to the 50 decibels. But in actual scenario, we are not emphasizing that. Or maybe in the new constructions, we are more focusing on that. But whereas in the existing hospitals, I think we need to do a lot of restructuring of it. I think when we are making a new kind of a designs, we need to consider that in our mind. So here we show a small video which demonstrate what is the importance of acoustics that has been talked by Julian Pope, the independent talker, on TED Talks.
It's time to start designing for our ears. Architects and designers tend to focus exclusively on these. They use these to design with, and they design for them, which is why we end up sitting in restaurants that look like this and sound like this, shouting from a foot away to try and be heard by our dinner companion. Or why we get on aeroplanes, which cost £200 million, with somebody talking through an old-fashioned telephone handset on a cheap stereo system, making us jump out of our skins. We're designing environments that make us crazy. And it's not just our quality of life which suffers. It's our health, our social behavior, and our productivity as well. How does this work? Well, two ways. First of all, ambience. I have a whole TED talk about this. Sound affects us physiologically, psychologically, cognitively, and behaviorally all the time. The sound around us is affecting us, even though we're not conscious of it. There's a second way, though, as well. That's interference. Communication requires sending and receiving. And I have another whole TED talk about the importance of conscious listening. But I can send as well as I like, and you can be brilliant conscious listeners. If the space I'm sending in is not effective, that communication can't happen. Spaces tend to include noise and acoustics. A room like this has acoustics. This one, very good acoustics. Many rooms are not so good. Let me give you some examples from a couple of areas which I think we all care about: health and education. When I was visiting my terminally ill father in hospital, I was asking myself, how does anybody get well in a place that sounds like this? Hospital sound is getting worse all the time. Noise levels in hospitals have doubled in the last few years. And it affects not just the patients, but also the people working there. I think we would like for dispensing errors to be zero, wouldn't we? And yet, as noise levels go up, so do the errors in dispensing made by the staff in hospitals. Most of all, though, it affects the patient. And that could be you, it could be me. Sleep is absolutely crucial for recovery. It's when we regenerate, when we rebuild our cells. And with threatening noise like this going on, your body, even if you are able to sleep, your body is telling you, I'm under threat. This is dangerous. And the quality of sleep is degraded, and so is our recovery. There are just huge benefits to come from designing for the ears in our healthcare. This is an area I intend to take on this.
So nice video. So at this particular forum, one thing I would like to emphasize is that the recovery of patients. So how do we achieve that in more faster way? The sleep is very, very essential one. In order to have the very peaceful sleep, we need to have a very acoustical comfort zones, right? So how do we achieve that? So for different areas, we have a different kind of a solutions, right? The first one is the reception. In the receptions, what we need to achieve is a very, very sound absorbing material have to be chosen as a ceiling material, as there are a lot of crowds would be there, and we need to consider the material with a noise reduction coefficient which is equal to or more than 0.8 or 0.9, so that it would be having a very good comfort level. The next one is the consulting room. As I already told you that it is a one area there we need to have the proper balance of sound insulation as well as the sound absorption. And then number three area is that wardrooms. In the wardrooms, what happens is the patient need to ensure the proper sleep. In order to achieve that, we need to have the comfortable ceiling. Even in the ceiling, we can create some kind of a creative images that is going to give a very good environment for the patients and for the fast recovery. If we see the ceiling applications in the hospital, there are some different zones are there, which are all having a minimal risk, and which are all the areas which are all having the higher risk. If you see this reception, the waiting area, which are all considered as a safety risk, as very minimal. And whereas if you see that operation theaters or MRI or ICU, which are all considered as heavy risk areas. So at those kind of areas, we need to go for a specialty ceiling, and we need to understand what is the need for that particular area, and accordingly we need to provide the proper solutions. In the coming slides, what are the specific areas and what are the specific solutions which we can offer? Number one is a lobby and reception area. So for there, we would recommend acoustical ceiling solution as well as with some kind of a designer ceiling solutions. So we have a number of ceiling options available. It is not only considering the mineral fiber ceiling. Apart from mineral fiber ceiling, there are soundscape basics, soundscape shapes, and we have the canopies, we have the woodworks. So these particular materials will make you a different kind of a feel and experience at the initial reception. So some of the examples, here it is done with some kind of a cloud axioms with the mineral fiber ceiling solutions. So these are all some of the newer concepts with the soundscape shapes, with the different lighting altogether. Nowadays, people started using a baffled ceilings. This is actually a metal ceiling. So this will give a different feeling like any other transport area or any other commercial spaces. So nowadays, hospitals are changing a lot, and a lot of renovations are happening. And number two, as I already told you, corridor is one important place where we need the acoustical as well as the ceiling should be a easily manageable one or easily accessible one. I think in many of your hospital facilities, you would be facing this particular issue. When we talk about the facility management for the hospital, I think that is a only very, very critical one in the entire buildings. Why it is, only in the corridor, there would be a lot of services which would be running. Let it be HVAC diodes or your lights integration or your sensors. And so there you need a lot of the services integration with a single ceiling tile, and it should be easily operable over a period of time without damaging the edge damages and all. So here we have a new product. This is our FS600 hook-on ceiling. So this particular ceiling we launched in the market with a BioGuard coating on it. So if the BioGuard coating is there, it can improve your ceiling performance over a period of time, and it is for a medical facility, so no need of any kind of antimicrobial or antifungal treatment further on this particular ceiling. Some of the reference examples with the BioGuard ceiling tiles. This is a clip-in area for a dining or for resting area. So coming to the important place, it is a wardroom. So in this wardroom, what we generally recommend is we need to go for the very clean room with the antimicrobial properties and antifungal properties. And it shouldn't make any kind of dust, or it should be kept very clean. The particle size should be kept very low. And this particular ceiling solution should be classified as per ISO clean room facilities. Some of the examples. Or what we can do for this kind of a, MRI or ICU room is that generally when the patient is lying down here also if you see the light glaring would be directly on the patients. So here we can incorporate some kind of a indirect lighting with a white color ceiling tile which would be having a light reflectance. So eventually over a period of time for the patients it would be give them a very good comfort. For the emergency rooms and for consulting rooms, we would recommend BioGuard mineral fiber ceiling tiles. So BioGuard, what is that in a BioGuard? So these are all actually antifungal tiles and clean room tiles, which won't be sagging over a period of time, which would be having a relative humidity of 100%. And that should be easily washable also. So washroom is also one of the very important area. So there we recommending metal ceiling solutions. Since over a period of time, because of the repeated moisture, it shouldn't be sagging. Some of the examples. And this is one really interesting new product from kind of ceiling solutions. UVC Luftreiniger. In German terms, Luftreiniger means air purifier. So this particular product or concept had been evolved post our COVID-19 attack. So this product we launched last year. So you could be seeing this particular profile, this product. This is actually called as a UVC Luftreiniger. This is very handy device which can be installed in any existing hospitals or even in the new hospitals also. It's just a fit out kind of a fixture which can be done below your HVAC diffuser, so that whenever the air passes through this particular UV ray of light, all the existing kind of the air particles or infection particles, everything would be cleansed. So I think post this COVID attack, everybody even in the normal home or office spaces are more concerned about the infection control. I think for the newer facilities in the healthcare or in the existing healthcare facilities, I think this should be made as a mandatory. Or not only this particular product, there are many products available in the market. So we need to continuously work on it for the infection control. In later stages, that is going to be helpful for the entire globe. Thank you for your attention. So in case of any queries, you can ask me. Thanks so much.
Thank you very much. That's a very interesting point. That video, as you rightly pointed out, is very interesting. And it's interesting to know that the sound levels of all of the noise in hospitals has gone up by at least 100%, but the acoustic systems and materials have not improved at the same scale. That's a good point that when you walk into a hospital, you're wondering how is a patient going to improve their health? If anything, it'll go even more crazy. Okay, so the reason why there's this echo is because our last and final speaker is joining us from Italy, in fact, one of our partners, Mr. Vedran Djukic, who is the Chief Technology Officer of OneSource Solutions International. And the final presentation for this afternoon is going to be the Foundation for Hospital Digitalization. So if we've got the system set up. So once.
Okay. Oh, thank you very much for having me there. So I guess I'm just going to start right away. We have short time, and after me, I think you have a good lunch waiting for you, so I'm not going to be the one stopping you doing that. So let me just quickly present you the title of today's presentation, which is the Foundation for Hospital Digitalization and Building an Inclusive is the key word here, the infrastructure for healthcare digitalization, remote monitoring communication, which we have also called AI ready, because we first have to have data, and then data can be turned into artificial intelligence application. So let me just start straight with the problem. About 3 years ago, telemedicine was perceived as not yet ready. Hospital and the healthcare providers were not having any serious intention to actually start using what the technology was offering. But you know what happened afterwards. COVID hit. And when COVID hit, a lot of healthcare companies were dying to have a solution that will allow their patients to be actually consulted remotely. So they gone from having almost nothing to having telemedicine. But telemedicine at that time was perceived as essentially a video call and a setup for patients to be able to be visited by doctors without getting to the hospital. And that stayed almost till today. Today, what we have now after 3 years of COVID, as you can guess, a lot of people has died. The average thought was that over 20 million people has died directly from COVID disease. And where was I the last 3 years? I was actually implementing in Italy, and Italy was the first country hit by COVID, the solution that my company is selling now and that my company is implementing now. And to do that, we were literally first responders and trying to install and did successfully install our equipment on medical devices that was over 40 years old, combined with data from the Bluetooth devices that was brand new on the market and actually got sooner on the market to actually help doctors and patients to be monitored. So that happened also with the ventilators. At the point, and even today, most of the ventilators are not connected. So if you're not in the room, you don't actually know how the ventilator works. You don't see the curves, you don't see the spirals, you don't see any information about if the settings of the ventilator is set up properly for that patient. You have to be in the room. So we had a serious problem where people were not allowed, the doctors are not allowed to get to the patient's rooms. But still, they have to be there to actually set up the medical devices. So the last 3 years, we successfully installed this and connected a bunch of old devices with brand new devices and defined actually what the telemedicine should be. So it was a convergence from a video call, essentially, to a critical care telepresence. And telepresence, it's essentially the ability to be in the room with the patients, seeing in real-time informations, but also seeing everything that happened with their patients in every related information about the patient. That goes from drugs to active treatment that the patient is having and his response to it. Okay. So we got also from the hospitals to ambulances. Same thing in the ambulance. We are able to connect inside the ambulance almost any medical device that was designed to be seen directly and was not designed to be actually connected in real world. I actually mean that we do connect Philips with GE, with Mindray, with Neopoden, with Draeger, but also a bunch of minor devices, including pumps. So what is the problem we're facing? What is the problem that we solve? Well, before I move on, I have to give you a little bit of context. And that is the circle of life. You probably heard that many times. Good companies has become good companies because they implemented innovations that they've designed. But once they have a good company, they keep on doing innovations, they keep on implementing those innovations. That keeps on keeping them good companies. But this approach, it's not only valid for the business. This approach is actually implemented everywhere. Let's talk about the nature, our own DNA. We share our DNA with bacteria all the way down to all possible life features up to the very humans, which are us, and still keep on discovering relationship and relations between our DNA and ourselves. IT. IT goes from first tubes and transistors to today's parallel computing, high-density CPUs, and even AI-specific CPUs. It's all gone from design to the implementation of the design to the good companies that has shared information, that has created new information, that has created new designs, and so on. Logistics. We've gone from the invention of the wheel to self-driving cars and drones. And you pretty much have a good idea how this is going to develop in the next few years. So what all of them has in common? All of them has essentially in common data and inclusive infrastructure. Inclusive infrastructure means that all the data and all the participants share the same data. But let me, you all know, tell you the other story when things didn't went that way. Let's say the medical equipment and the medical devices. You know they're local. They are designed specifically to be read locally. You know all your vendors, they want you to buy only from them, and therefore they will not integrate medical devices from third parties. So you have never seen a central station from GE to include a Mindray ventilator or Mindray monitor. You will only see one single vendor doing that. And then you have a regulatory burden. It is specifically dramatic because even today, we have a perfectly working communication being tapped and stopped due to the regulatory because the manufacturer don't want to spend another year testing and regulatory the output system. So we are in the medical devices are everything but seamless data export and inclusive infrastructure. And we know how this goes on. When you have system like that, sometimes, but only sometimes, it happens that keystone species in nature or keystone companies invent something or do something that completely changes the way how things goes. So let me present you OSSI, and OSSI has done exactly that. The OSSI has designed a system that is a foundation for any hospital digitalization and medical device data integration. So we integrate essentially almost any medical device, despite of his, into a single system that can be used by multiple other systems. So if you want to have information from any medical device on a single piece of glass, you have to have this information. You have to have this data collecting that goes directly into a system and then can be shared with your colleagues inside and outside the hospital. I'm going to be a little bit more faster here. And you can see what else can you do when you have a full rich information. Another very important information is how to get data in and out from almost any EMR. So today we might have all the new EMRs. We might have EMRs that are easy or not easy to use. So we also created a single access to almost any EMR. I'm going to be very fast here. This is kind of technical. But you can see that we are doing this with IoT devices that are directly connected to medical devices. That's also true for home or laboratory. And taking out all the information, normalizing them. When I say all, I mean waveforms, alarms, and everything related. And then eventually put them into the system and bridging the status quo of today to the future. Now, for my ending line, how the telemedicine is going to be highly depends on you and your choice of what you want to use. Now, imagine that the highways were made for just one type of a car. Let's say the highways is only for Mercedes, and you might have highways only for BMW or Tata, you name it. Now, imagine how that will be. Imagine how our future would be if you choose to have a single vendor creating all your infrastructure with an inclusive, non-shareable data. Well, I'm going to leave you with that. Thank you. You can contact us from the information that you have received here. We are a Boston-based company. And our main approach is to create any digital foundation for any hospital. Thank you very much.
Thank you, Vedran.
Thank you.
Okay, very well, ladies and gentlemen. So we have come to the end of the conference session. Thank you all very much for your attention. Greatly appreciated. We shall now break for lunch. Post-lunch, we shall conduct the one-on-one business meetings. I'm sure that will be of immense value to all of you as well. Now, before we go and head out to the dining area and enjoy the scrumptious lunch on offer, I would request everybody to please come towards the stage area for a group photograph that we'd like to take as a memory of this event and as a memory of this moment. All right, so that's me signing off. And on behalf of ET Business Consulting, once again, thank you very much for being a part of the 8th edition Healthcare 360 Summit. It's been great to have all of you here with us. We look forward to hosting you once again for the 9th edition of the Healthcare 360 Summit, and we will keep you informed about when that is happening and, of course, where that is happening as well. This has been an endeavor to bring to you the best minds of the healthcare business and to open up all of our minds as well, and we are confident we have achieved that purpose. On that note, thank you very much once again, and see you all very soon. Please come forward towards the stage for a group photo. Thank you.
Bharat Gera, the founder of Human-Centric Healthcare Ecosystem, HCHE for short. I consult on digital transformation with hospitals, and I'm on the board of startups, medical device and healthcare startups.
That's good to know. So, you've been a part of the Healthcare 360 Summit today. Describe in a nutshell your experience of the event.
It was great to see an interdisciplinary approach where we had people from different aspects of the hospital, from projects, operations, and IT. It was really good to get everybody on the same table and discuss these issues about smart hospitals.
What do you have to say about the kind of audience that you had today, the peers that you were able to network with?
Very interesting, a mix of people from startups, hospitals, and general interest. Everybody's interested in healthcare these days, so it was good to see a good participative audience, even from academic backgrounds.
Thank you. And last question, very simple. Describe the event in one word only.
Fantastic event with a lot of, oh, you want one word?
One word, yes, that's the catch.
Good mix.
It's 2 words, but okay. Okay, Deepika, thank you very much for being a part of this short Q&A. For the benefit of viewers, please introduce yourself with your name and a little bit about what you do.
Hi, my name is Deepika Grande. I am the Business Development Head for Cleveland Clinic in India. I also run a company called IMAS HealthCare. I'm the founder director of the company that offers teleconsultations for patients from India with providers from various Cleveland Clinic locations.
That's good to know. So you've been a part of the Healthcare 360 Summit today. How was your experience of the conference?
Well, the experience has been phenomenal. It was great to learn from the executives and leadership from various hospitals. It was a very engaging session to learn about hospital design and acoustics, things that have never been exposed to. It was I've learned as much as I've probably given to this conference.
What was the highlight of the conference?
The highlight of the conference was really the enthusiasm that healthcare leaders, the startup companies, the various vendors have expressed in improving patient outcomes. That definitely was, I think, a common theme throughout the topics, and it was very rewarding to hear that.
And what do you have to say about your fellow audience and peers that you had the opportunity to network with today?
It was fun. I think we've, I spoke with a few hospital administrators, learned about the importance of healthcare communication and training that's happening in various hospitals. Spoke to a few vendors who are into clinical research, nutraceuticals. So it was a very diverse audience, and it was, great to network with everyone.
My last question, a semi-trick question. Describe the conference in only one word. What is that word?
Very engaging.
It's 2 words. But okay, engaging.
Engaging.
Thank you very much.
Yes.
Appreciate it.
Yeah, thank you. Yeah.
Myself, Sandeep. I represent Knopf Ceiling Solutions, Karnataka. And we are into complete ceiling solutions in terms where people play, learn, and actually heal also. So healing is a part where this event is all about, and the healthcare summit, they talked about the complete. I mean, it was covering most of the segments, which is very important in day-to-day life, because we see post-COVID, there are many challenges which are how to say, I mean, it has not been addressed. So this event is actually an eye opening for everyone. And most of the topics which were discussed were very relevant to the current situations, and it was very interactive for that matter. And I wish them all the best, and continue doing the same thing, and empower everyone. Thank you.
Thank you, Sandeep. My name is Amrita Subhash. I represent Canop Sealing Solutions. I do actually a sealing solution specialist. We are actually into the technical support for any kind of a sealing solutions. I represent for South and East regions. So talking about today, it's a very good organization um, and a very good show today for an entire day, right from beginning till the closure. I could see, the lot of events. It went really well, and especially the interactive sessions. It was actually it was outstanding. It has opened up many unknown things come to the limelight. So it was a very good thing. And as a presenter, I also really enjoyed giving our presentation, our part to the healthcare facilities. Hope it will be a very good for everyone. Thank you so much for organizing. One second. Yeah.
Thank you, gentlemen. Did you feel that you met any delegates that will be interesting for you to pursue from a business point of view?
Yes, definitely. We could see, a lot of industry leaders, a lot of, hospital owners, a lot of consultants, and a lot of architects. I think, this is a wonderful opportunity for us to make a good networking, to know about the solutions and know about the market, and to further take it forward for any kind of business developments.
Sandeep, anything to add?
Yeah, I mean, see, every person who came here are best in their own fields, but it's not that they know everything about the industry. So it is always better to get connected, and I urge most of the other suppliers or vendors to be part of this event, which they organize next year. If so, I really will be a part of this event if they are organizing it again. It's really good to meet top brass healthcare people over here, like Apollo, Sakara, Manipal. I mean, it's always good to
Fortis.
meet Fortis to be that. I mean, if I have missed out anything, please don't mind, because it's always better to get in touch with the direct client, and because we directly are able to add value to their facilities. So that's what we are trying to make. It's not a business kind of perspective, but making them aware that yes, there are brands which add value for their offerings which they do. So thank you.
Gentlemen, sure. Last question. Choose one word to describe the conference today.
Excited,
Only one word. Sorry?
excited, and looking forward for more
Exciting.
options.
Okay, very good.
It is very interactive.
Interactive. Very good.
Yeah.
Thank you very much. Appreciate your comments.
Thank you.
Thank you.
And look forward to seeing you again very soon.
Thank
Gladly.
you so much. Yeah.
Okay. Thank you for being a part of this short Q&A with us. Please start by introducing yourself, your name, your job title, your company, and a little bit about what you do.
Okay, all right. Thank you so much. So I am Sophia, and I work at Jobizo. I work as the Senior Manager Strategy and Marketing. Jobizo is a healthcare tech startup. We are into healthcare hiring. So you can consider us as an Uber for healthcare hiring.
Very good.
Yeah.
So you've been with us for the event and conference today. What is your experience of the conference?
It was a fantastic event. We are dealing with the healthcare industry, and it was so good to meet all the potential clients, and we got a lot of hot leads from the event. Thank you so much.
Yeah, on that. So do you think that the leads that you got were have a high potential? You can follow up and potentially get some good return on the business from those leads?
Yes, definitely. I hope so, and I think hope is life.
Well said, well said.
Yeah.
And what about your peers? What do you have to say about your fellow audience members and the kind of people that you've met today?
Brilliant. I think, meeting all the executives, the management, the decision makers of the healthcare industry. I mean, it was such a surreal experience for me.
Very good. And what was the highlight of the event in your opinion?
Getting the hot leads, which I was supposed to get from the event. And of course, designing everything for the event, like, from the passport to the boarding passes to everything. And I mean, when I saw the audience getting intrigued and, coming up to us and understanding what Jobizo does, it was like, I'd put my heart and soul into it, and it was all worth it.
Would you mind showing the pass and the passport?
So this boarding pass is your pass from, cost-heavy, tiresome hiring to free, effortless hiring. And this is your passport, basically, the Jobizo passport to the healthcare hiring. And it has all the details of, how we've empowered our clients to provide like better patient care, how you're able to hire in 10 minutes, our success story, and why. What is it like, stopping you from joining us? Thank you.
I think that's very cool. And final question, Sophia, a little bit of a trick question.
Okay.
Choose only one word to describe that event, to describe our event. What is the one word you will choose?
Fantastic.
Fantastic.
Thank
That's
you.
what we like to hear. We really appreciate your kind words, and we look forward to seeing you again very soon.
Thank you so much.